Hello and welcome. Today we're presenting a pilot project where learning mobility was used to enhance nurse education on global health inequalities and concerns. My name is Collette Kirwan. I'm one of the project facilitators of this project. And
hi, I'm Neve. I was one of the students who took part in the project.
Okay, the aim of the presentation is to showcase a learning mobility pilot project using a virtual journal club as a service learning when travelling was not possible. COVID was a problem. Underpinning this, the project was 3 core concepts. One would be learning mobility. Learning mobility is a learning experience or an approach where individuals move out of their usual day-to-day operations and to experience another environment. Therefore, often this involves international travel or international learning. It is found to be a very effective way to develop social, intercultural and interpersonal skills. The second concept is service learning. This is an educational approach where students learn theories in classrooms and while simultaneously partake or volunteer with a group. This could be an NGO or a service body, social service related body. Reflection and debriefing are a core concept of this approach to deepen understanding and to deepen change. And finally, the journal club. This can be described as a regular gathering of a group to share and discuss evidence-based and see how can this influence practice. So the background of this project. Since 2012, the School of Nursing and Midwifery in University College in Galway run an elective nursing module. It's called International Nursing, Nursing in the Developing setting. It is available to second-year student nurses from the University of Galway, in addition to visiting third-year nurse students from Fairfield University in the US. Learning mobility and service learning are core concepts underpinning and involve Fairfield students visiting Ireland, in addition to the University College of Galway students visiting Tanzania, a healthcare centre in Tanzania. But in 2022, earlier this year, this was not possible due to COVID. Therefore, we introduced a new concept, or a new approach, a virtual learning journal club. And established so as to make sure that we did realise service learning and learning mobility as part of the objectives of the course. So who's involved? 3 main actors. The first is Manjaro Healthcare Centre in Tanzania, who have been our partners in the University of Galway for a number of years, since at least 2012, and where our nurses do travel to get field experience. In addition, Fairfield University students come to Ireland for 1 semester when they undertake 3 to 4 modules. So now I'll hand you over to Neve, who will present our team and the project activities.
Hi, so our team consisted of 6 teams. 1 team coordinated it. 5 teams consisted of a mix of students from the University of Galway, Fairfield from the United States, and a mix of healthcare staff from the Tanzanian Healthcare Centre. So what did we do? We worked together in identifying and presenting lectures on global health issues that highlighted these issues between the 3 broad regions of Ireland, the United States and Tanzania. This was presented through slideshows and then also condensed into posters. So Team A, their presentation was on vaccines in Ireland, Tanzania and the United States. This Team B presentation was on the impact of malnutrition on communities in Ireland, Africa and the United States. Team C, their presentation was education on HIV and AIDS. Team D was on socioeconomic status and the effect of health determinants. Team E was on HIV and the prevalence and impacts on the 3 different regions. So how did we communicate? So it was a virtual journal club, convened mainly through Zoom. We were able to use PowerPoint share and shared Word documents while on Zoom for our team work on the presentations. So how did it go? While overall students were positive about the initiative, they also found it challenging and difficult at times. Around 50% of students were satisfied, while 1/3 were unsatisfied. And the main issues were connectivity, access to technology, and virtual learning literacy. So regarding global health, some feedback was that it was eye-opening module. They really enjoyed engaging with the international healthcare workers. It was very interesting to see how things are done differently between countries. Another said that they enjoyed learning about real-life topics that affected communities around them. And another said that they enjoyed learning about the issues around the world and thinking about these issues as healthcare workers. Regarding international engagement, some said that they thought it was very interesting getting to interact with people in Tanzania. The communication issues of broken dialogue due to internet reception and a lack of engagement because of work commitments. Another said that they found the idea cool, but it was very hard to work and communicate via technology. Another said that they really liked interacting with the class with Tanzania, but they found Zoom a bit challenging. Another said that to improve communication systems with Tanzania. And this insight informed our next step. And I'll pass you back over to Collette to explain more.
So yes, as Niamh said, that last step in particular drove us to really look at how we approach this. So the University of Galway is a global university, and part of this initiative was the Galway Global Galway project, that has a strategy to support the creation and sustain the creation and development, we'll say, of sustainable internationalization structures and education initiatives, one of which is learning mobility. And therefore, we submitted and were successful for a grant in conjunction to the Global Galway project, in conjunction with the School of Nursing and Midwifery, to start up an education hub in the Tanzanian Healthcare Centre. And we, as a result of this, it afforded us 2 staff members to go to Tanzania to train up key healthcare professionals in virtual and IT technology in education. So it allows them to continue doing the virtual journal clubs, both with the university, and hopefully we will extend this to including the hospital also. It also affords us to supply or to provide some IT equipment, and this includes laptops, a projector, a camera, and microphones. We hope that this will allow us to continue this engagement with Tanzania Hospital and for us to expand, we'll say, learning initiatives as we go forward. Thank you for listening, and we are very happy to answer any questions that you may have.
Thank you.
Thank you.